From Social Prosperity Partners, this is Community Catalysts. Welcome to Community Catalysts, the podcast that examines the qualities of community leadership and the many paths and forms it can take. I'm your host, Matt Lehrman. Our guest today is Matthew Pepper, the President and Chief Executive Officer of Michigan Humane, the 147-year-old nonprofit whose mission is to improve and save lives through compassionate care, community engagement, and advocacy for animals. He's accepted our invitation to unleash the story of his journey to leadership so we can all fetch some valuable lessons from his experience. Matt Pepper, welcome to you.
Thank you, Matt. I love the fetch, by the way. Nice way to throw that one in there.
All right. So, Matt, I think you and I should disclose to everyone that we're actually picking up a conversation that we started while we were waiting for drinks in a crowded bar in Portland, Oregon last November. We were both attending the annual conference of the Association for Animal Welfare Advancement. You were completing your term as chair of the association's board of directors. I was there to deliver an inspiring conference keynote about forward-focused strategic leadership. And also, that wasn't the first time we've met. You and I have worked on a couple of strategic planning projects in recent years. But Matt, this is the first time you and I are actually sitting down for kind of an extensive one-on-one chat. And I'm really glad to have the opportunity to talk with you.
Well, thank you, Matt. I'm happy to be on. And you and I have always had some great conversations that consistently leave me thinking about what's next for us. So I appreciate all the instigating of positive thought you've brought to me.
Excellent. So we have a lot to talk about. I really want to get to a conversation about strategic planning. But before we look ahead, let's talk about where you've been. Your career in animal welfare has taken you from Shreveport, Louisiana, to Memphis, Tennessee, to Albuquerque, New Mexico, and now you're getting close to 10 years as the president and CEO at Michigan Humane. Matt, take us back. What was the experience that set you on the path to a career in animal welfare?
Yeah, so I'll actually take it really while I was in the middle of college. I went to Grand Valley State University, a great school southwest of Grand Rapids, and I was in advertising and public relations, and I realized it wasn't what I wanted to do. It didn't feel right to me. And I'd always been somebody who was outside. I'd always loved being around nature, being around animals. So much to my father's chagrin, who was helping me through college at the time, I told him I was going to change my major, and his statement was, what do you mean? He's going to be economics? You're going to go into general business? What are you doing? And I said, wildlife biology. And he made me promise two things. One, never judge success on what he had. He had a great successful career in the for-profit world. And no matter what I chose to do, I was only successful if I gave it everything I had. And so I began working in, actually, while I was in college, I was in Kenosha, Wisconsin. I was the kennel manager. And I say kennel manager, but I was the only employee, and I gave myself that title because it looked good on a resume. But this is actually coming back home at Michigan Humane. I'm from Grand Rapids area. I was an animal cruelty investigator and an animal control officer supervisor for several years in the Grand Rapids area. Then it was raising my hand to see what's next and who would offer me the opportunity to chase a dream. And I would say, while I frightened my father with my change in major, I frightened my wife when I moved her across the country to Louisiana with 3 kids at the time. But it was a great experience. From there, I went to Memphis. Memphis, it was as you noted, Albuquerque, and then about 10 years ago, I had the chance to come home. And this was a great opportunity. I put the personal side of it was my family was all here. I could chance to be closer to family. Michigan's always been home, and the organization I'm a part of is a storied history of doing some incredible things in the Detroit area.
Matt, when you changed your major to wildlife biology, what did you think you were going to be doing for a career?
Oh, I thought I would be, out in the woods, working on, wolf habitats or deer populations and managing sort of that type of activity. So I originally thought I was going to be up in Isle Royale working with the moose and the wolves, or at one point I had an opportunity to go to Africa, which my wife was much less inclined to follow me there. So we ended up not taking that opportunity. But it would be working with animal populations, conservation, those type of activities.
So basically, you thought of yourself as an animal person. You enjoyed being around animals. That was more important than being around people.
So, I thought that was the case, but as I've evolved in my career, I don't think it is. I think it's people's passion that gives me energy. I think I used to think it was the work itself, and I love the work. It's inspiring. It's amazing. I love the work. But as I've evolved within this organization and within the industry, I've come to realize it's the people that give me the energy more than the work, if that makes sense. When you see how people connect to their pets in such a strong way, there's it's kind of hard not to be inspired.
So there's a dual tracking here, I think, because what you just said was that in your career you had to discover that your passion for animals translated into the idea of a career in animal welfare, and that there is actually a profession of animal welfare. And my understanding is the profession of animal welfare has also kind of evolved over this time as well, that it's identified itself fully. Maybe there are people who are listening who don't understand. What is the profession of animal welfare?
I think the profession of animal welfare is managing, maintaining, defending, and protecting the human animal bond. And I say that because it's more than just sheltering of animals in the community. It's more than just the cruelty investigations. It's making sure that families stay together with their pets. It's making sure that animals are reunited back with their families. It's really about making sure that an animal's role in creating a healthy and safe community is valued and protected.
The animal human bond, is that a concept that's evolved over the course of not just your career, but like over the last 50 years or so in the country? Is there kind of a greater awakening or an understanding of what that bond is about?
Yeah, so I'll give you a great example of how we think about the human animal bond, and how I think too often within our industries, our specific industry, we think too much just about the animal side of it, and we call it a human animal bond, but don't think about the human element and don't ask that second question. I'll tell you a great story. During COVID, there is just this incredible woman by the name of Cynthia. Cynthia has no legs and one arm. She struggled with health and transportation her whole life. She has 7 cats, and she, in the middle of Michigan winter, in a wheelchair, got herself from the other side of Detroit to our west side of Detroit pet food pantry for cat food. And I think traditionally we would think we fed the cats, and that's the action item there. That's the outcome, is that we fed the cats. But the reality is, what I would ask you to do is, if you think about the human animal bond, is think about Cynthia's life without those cats during COVID. Think about the isolation she's facing. Think about the feelings of loneliness that she must feel had she had to surrender those cats. That's the other end of the human animal bond that I think sometimes we minimize. She was willing to sacrifice her own health and safety in a wheelchair across the city of Detroit to get food for her cats. Imagine what else she is sacrificing of her own needs for those cats. So if we can find a way to fill a gap and allow her to feed her cats and allow her to continue to build in that relationship, what else in her life can she then address? And that's sort of how we at Michigan Humane extrapolate that out.
It's a great story. It also tells me a lot about you and your evolution from being a wildlife biologist to being a professional who cares about the human animal bond. Is that just your story, do you think, or is that a common story for a lot of people who consider themselves animal welfare professionals now?
Well, I think that's a great question, and I think there's sort of a divide happening right now. Not necessarily a hostile divide, but a divide. I think we've got, for a long time, I think our industry was solely worried about, how many adoptions we had, and what was our live release rate and everything that happened within the walls of our shelter. And I think we got lost a little bit based on that singular focus. So I'll use another great example. Michigan Humane started in 1877, and we didn't start around companion animals. We worked with horses, which at that time were much more urban animals. They were, anything from transportation to carriage to everything in between. And our other charge was women and children, the subject of domestic violence. And I think that some people talk about this being a mission shift, a shift in us really trying to consider ourselves a human organization that just uses pets as a way to improve the human condition. But the reality is, it's not a shift. It's kind of coming back to why we started. We started around the human element and helping people.
I wanted to talk more about that because I don't often get to talk to someone who leads a nonprofit organization that's 147 years old. So, walk us through a bit of the evolution of the organization and how is it different today than it would have been, I don't know, 20 or 50 or 100 years ago?
First of all, I think it's important to know the community that we're in. And I think a lot of people think of Detroit and immediately they think of crime and poverty and issues. And those issues are real. We face them, but the reality is it's a fiercely proud city with incredible people in there. And it's not all the city that people imagine. So, for example, we've got Detroit and some of the issues that come with that, including poverty. Close to 40% of our citizens in Detroit are at or below poverty level. And then you've got you cross the street and go to the north, and you're in one of the wealthiest communities in the country. So we've got a real strange dynamic in our community, but we've been in this community for a long time. And I think what we did, what a lot of animal welfare organizations did for a while, which was, I think, misconstrue outputs for outcomes. And what I mean is we would talk about the number of adoptions and that was success. We would, a story would come into us and it would be a dog that was broken and we would fix the dog and then a adopter would come in and it was a happy ending and they walked off into the sunset. And we thought that was the end of the story. In about 2019, we saw as a board of directors and as a leadership team saw that the industry was changing, the conditions and factors around the industry was changing, and we had to change with it. So we went through a significant rebrand at that time. And what we realized was that everyone in animal welfare uses this narrative of the hero, the Jungian archetypes of the hero. Look at what I have done to come down and save the people that needed saving. And we made a conscious decision that we were going to not serve the community, we were going to partner with the community. So we went with the archetype of the everyman, the orphan, people who, instead of saying, "Here, I'm going to help you," it's pick them up by their hands and say, we're going to do this together. And that caused our organization to do a lot of thinking about how do we engage the community? Are we in a community or are we part of a community? And we wanted to be part, not just in. So the rebrand led us to talking to our community about what's important to them. And here's what we found. We found that people in Detroit love their pets. So much so that they were sacrificing basic human needs for their pets. They were feeding their human food from a food pantry to their pets. They were using what money they had for vet care rather than getting their own needs met. And we realized that there was three things that were important to people in Detroit, people in Metro Detroit, and that was a healthy community, a safe neighborhood, and an economy where they can support their family. So what we did in 2020 was kind of shift our focus to everything we do having to fall into one of those three pillars. Does it create a healthy community for people? Does it create a safer neighborhood for families? And does it help the economy thrive and build and grow to support the families? So a great example. Why do we do adoptions? I think most organizations would say because it's a great outcome for the dog. We do too. However, you're 31% more likely to be active if you have a dog. You're much less likely to have issues with heart attack or stroke if you have a dog. You're emotionally more supported if you have a pet. People that are outside walking their dogs are more connected to their neighbors, creating more connected neighborhoods. So there's a human element to everything that we do.
Matt, I want to ask you to unpack this a bit more because now I remember this is what you said while we were standing online waiting for our drinks, and I didn't write it down, but I really want to understand this healthy, safe, and economy. Unpack it a little bit for us. I want to make sure I understand. You're telling me that's become the guide star for everything that Michigan Humane has done. Am I understanding that?
You are absolutely correct. So we were an animal welfare organization for 144 years, and for the last 3, we've been a human health and human service organization. I consider even our mobile services are delivering human health because of what people will do for their pets. But I'll take you back to those 3 items, and what we realized is that we weren't telling our story. We weren't connecting to the community because we were telling people what was important to us. We weren't listening to what was important to them. And when we started to do that, we recognized that pets have a role. They're incredibly important, but we're in people who are struggling with poverty in Metro Detroit, we're competing with a lot of other issues. We do have kids in third grade classes, and we come in and talk about what it's like to have a great dog and a pet ownership. And then we sometimes forget that kid's got to go home and wonder, am I going to be safe on the way home? Is there going to be a parent home when I get home? I got to have food to eat when I get home. And we quickly get pushed down the priorities, people's priorities, when we simply focus on the animals. But when we started to think about those three items, what was important to people, health, safety, and the economy, we did research on our work and how does our work impact that. So we realize now that that pet ownership is significant for mental health and for physical health. We know that safe spaces in communities for people to congregate create safer communities. In a city like Metro, I mean, we've got the University of Michigan, 20 minutes southwest of here, one of the best universities in the world, and we can't keep our talent. And why? Because we're not a very animal-friendly city, and this new generation of workforce is making life decisions on based on their pets. And we don't allow for that to be a factor here in Metro Detroit. So we created this vision that's around health, safety, and economy to turn Detroit from really one of the least animal-friendly cities in the country to what we're calling the most humane city in the country. And when we went through our rebranding, we dropped the word society. And we did that for three reasons. Number one was the word Humane Society is a generic term. So we kept getting confused with the Humane Society of the United States. If I give to them, they must be funneling down to you, or local humane societies. I give to them because I saw the work you do. So we wanted to differentiate ourselves within the industry. The other two are a little more philosophical. And it's we talk about what we are all trying to accomplish in terms of being more inclusive in our work and in our communities. The word society inherently is an exclusive word. So we dumped it as a way to just highlight our commitment to being a part of the community. And then it's the word humane alone. Humanity doesn't limit itself to how you treat pets. It's how you treat people. And what we've come to realize is that when you treat someone as a partner, and when you engage in someone in a way that you're there to help, their whole world opens up to you. And now we've got an opportunity, and I would say an obligation, to address other issues. So we've now since brought on social workers onto our team. So if I give you a bag of food out of our pet food pantry, we have 20,000 families and 1.75 million pounds of pet food we distributed last year. I'll give you a bag of food so that you can feed your dog. That's the narrative change. It's not me feeding your dog. It's I'll give you a bag of food so you can feed your dog. But then it's the second question. Hey, if you're struggling feeding your dog, are you struggling feeding yourself or your family, and do you need help? And if so, our social workers will connect them to a human food insecurity organization. I'll give you another great story. We have a call center that takes about 250,000 calls a year. And that second question is so important when we start to consider the human element. Our work isn't done with the animal. We had a woman call our call center and say, my cat's leg is broken. I need to make a vet appointment. And because we send our staff through Health and Human Service navigator training, and they're trained to listen for cues on other issues, these ones aren't social workers. They're just asking the question. One of our call center workers, was hearing something not right. And after we got the cat scheduled for an appointment, the question was, ma'am, are you okay? And the answer was, no, I'm not. My significant other did this to the cat. I'm worried he's going to hurt me, and I don't know what to do. So we were able to get her in touch with a domestic violence shelter, get the cat into a temporary foster situation, and save, in essence, really save that woman's life, all because we asked a second question through the cat.
Matt, I have to ask you two questions on this. The first is kind of a basic question. Do you define Michigan Humane then as something other than an animal welfare organization? How do you boil that down so that someone actually understands everything that you just said in a nutshell?
I call us a human-centered organization that uses the animals to impact the human condition.
That uses the animals to impact the human condition. So I want to go back because I read your mission statement into the introduction, but I was curious about the wording of it. The mission statement is to improve and save lives through compassionate care, community engagement, and advocacy for animals. So the animals came at the end of the mission statement. And I was curious, is this what you've just reflected? Is that the animals are about influencing the human condition in your community? It's not just about the animals.
Correct. And let's take that one step further. A pet is only as healthy and safe as the family it lives with and the community it lives in. So this work to improve people's lives only serves to create better environments for the pets. And I will also tell you, in our mission statement, you'll know that it says improve and save lives. It doesn't say improve and save animal lives, as you note. It's improve and save lives, which is human lives, animal lives, and everything in between.
So then I have to ask a follow-up question. A lot of leaders of nonprofit organizations, when they do their strategic planning, they are accused of mission creep. That is, that their missions are so broad that they say yes to everything. Matt, if Michigan Humane's mission if it essentially boils down to this trifecta, you say, of healthy, safe, and economy, then what are the kinds of things that you actually, as an organization, say no to?
Well, that's a great question. We say no to things that don't have a partner. Everything we do has to be involved with a health and human service partner. So, for example, our pet food pantry, which is one of the largest in the country, this year we anticipate distributing 2.5 million pounds of food out of a 26,000 square foot warehouse. That warehouse is in a space we share with Gleaners, which is a human food insecurity organization in Southeast Michigan. And how we got there was by learning to speak the same language. We've all had those meetings where you meet with someone and the person across the table is clearly looking at their watch because they're meeting with you because they're supposed to. That was my first meeting with Gleaners. My second one, I came armed with what was important to them, which is a study we did on some of their clients that found that 50 to 70% of their clients who were taking human food were giving it to their pets before they were feeding themselves and their families. So now I'm speaking his language because if you're not using me as a partner, half the time your food's not going to its intended purpose. And so now we've got a collaboration, and we ended up leasing their 26,000 square foot warehouse. We co-house, we use their distribution model. So the things that we don't do are when they are typically reactionary. Outside of some of our law enforcement activities are reactionary. You brought up a strategic plan, and I'll tell you, we went a different direction. We had a facilitator who kind of walked us through a strategic roadmap, we called it, which was nothing prescriptive. It was just guardrails that we have to use. And they were, let's focus on non-philanthropic revenue and sustaining our opportunity, other opportunities. But it was also, the big one was working systemically, that we wanted to go as everything we do as far upstream as we can. So, a lot of organizations, someone walks in to surrender a dog and you say, fine, let's take the dog. We want to know, what was the incident that caused you to have to surrender that dog? And can I get far enough upstream to keep that pet in the home where everyone benefits from their from the pet being in the family? But to your point, if we can't show that it is sustainable, number one, that it's fundable and sustainable as a nonprofit, we're roughly a $25 million nonprofit in a year, and 20 million of that is philanthropy. So, we've got to make sure we can only do as a nonprofit what the community will support. So obviously we have to make sure that it makes sense at their returns. But if it does not fall into those three categories, if I can't show that what I'm doing has an impact on health, safety, or the economy, then we won't do it. And what we have found is since we've used those pillars, our relevancy has greatly increased in the community, because we're not just telling people what's important to us, we're reiterating three big issues on the minds of people in Detroit. And I'll give you a great example how that narrative has helped us. Children's Foundation in Detroit is a foundation that supports health and safety of children, as you would imagine, the name would indicate. And I met with their CEO a little while back, their previous CEO, they have a new one now, who is a great partner of ours. And the first thing he said was, hey, just want to let you know, we don't fund animal issues. I said, I know you don't, but you do fund children's health and safety. And do you know that 80% of dog bites in the city of Detroit occur in a home by a dog that's either unsocialized or unhealthy? And our work going door to door or in the community, providing vaccines and providing behavioral support and access to veterinary care is creating healthier, safer units inside the home. And the answer was quickly, now it makes sense. Here's your funding. Let's go on and forth and do something positive.
I think I shortened your language down when I talked about a healthy, safe, and economy. Say the whole thing again for me so it's clear.
Our pillars are healthy communities, safe neighborhoods, and a thriving workforce and economy. And when we talk about workforce and economy, that's kind of the one that people sometimes have a hard time wrapping their head around. But think about the average person spending $1,300 a year on their dog or cat, on their pet. We want them to spend it here in Detroit. Think about the people who are making life decisions on where they're going to live based on their pet. We want that to be here in Metro Detroit. And then the other side of that is we talk about a lot about mobility, but it's also about career mobility and offering people an opportunity to see themselves in the veterinary profession. So we have really dove into education, and with the focus on turning Detroit into a hub for diverse veterinary talent. It's healthy communities, safe neighborhoods, and a thriving workforce and economy.
What I just took from what you just said is that this is what you get for not chasing statistics, for chasing impact. And it gives you a focus to figure out where your precious, scarce resources need best be directed.
Matt, I could not have said it any better. What we're trying to do now is chasing true outcomes. And I think in our industry, we misconstrue numbers for impact. You know, we talked earlier about adoptions or the number of sterilizations I get, and that's our impact on the community. That's not an impact, that's a number. The real outcome is when I adopt an animal to a family, what fundamentally changes in the life of that family and that pet that I can measure? What fundamentally changes in a community when animal-friendly practices are more prevalent than they are right now? So you're absolutely correct. We're trying to shift our organization to be more in line with Health and Human Services, who are probably 20 years ahead of us in terms of identifying the difference between an output and an outcome.
Matt, we're at the end, and before we wrap up, I want to ask if there's anything I haven't asked you about that that you were hoping I was going to talk about, or that you were going to talk about.
Well, I just want to tell you that this real process about what's our impact on a community, I'm gonna give you a lot of credit, Matt. It was when you and John hosted an event 6-7 years ago that really got me starting to think about how our impact on a community can be measured, and what am I trying to measure to begin with. So I always get inspired every time you and I sit down and chat. I know you do a lot of great work both within our industry and within multitude of industries, but I just want to give you credit for really sparking the change within our organization with that really incredible conversation we had probably close to 7 years ago now.
I appreciate that, and it's a pleasure to watch you do the incredible work that you're doing. I'm really excited for you. Matt Pepper, I am so grateful to you for opening up to this conversation. Thanks for making it such a positive experience.
Oh, thanks. Positive. I love it. All right. Thanks, Matt. I appreciate it.
Again, my thanks to Matt Pepper, the president and CEO of Michigan Humane. This episode was produced by Kerry Lengel and edited by Nick Living the Dream Tantillo. Jenna Maisel is our production assistant. Our executive producer is John Little. I'm Matt Lehrman of Social Prosperity Partners. If you have a question, comment, or story to share, reach me at 602-688-2724 or Matt, M-A-T-T, at socialprosperity.us. I'd love to hear from you. We'll be back soon with another Community Catalyst.